So the project title was the COVID Rapid Testing LAMP project. So essentially this was a new testing technology that we used for rapid testing of people living in homeless accommodation. Previous to that we had been running a testing regime where we'd isolate people first and then they'd be tested, which meant we'd have to wait for test results sometimes up to 72 hours, whereas now we could have test results in 10 minutes.
We understood that making appointments was difficult for them, going into large clinical settings was difficult for them. So we found the Abbott Now ID testing machine, and we recognised that it was highly portable, so we could bring the machine to the person, either in their hostel accommodation or, unfortunately, if they were sleeping on the streets, we could bring it to them there in our mobile health unit.
One of the things we did during the COVID response was we isolated people from when they became symptomatic. We would have to wait between 24 to 48 hours for the results of their COVID test. Most people, practically 4/5 of people that we moved into this isolation, stayed for 48 hours and then were negative and had to leave. This meant that we had nurses, isolation specialists, key workers employed to support a huge amount of people that didn't need to be in isolation. This test produced huge efficiencies. This meant we could save money because we didn't have to staff the isolation unit for as many people, but also it saved on client time and disruption. They didn't have to rush off and spend 2 days in a place they didn't need to be.
We see that we can build upon this learning and the interagency approach to now not just look at COVID, we're now looking at many other health conditions. We're working with the agencies around more effective case management and care. And really, when you look at the most vulnerable, with people who cannot navigate our system, who have poor levels of English, we cannot do any more than bringing the care to the person.